and welcome to the Life Unites Us September webinar, Pathways to Progress. We're very happy to have Secretary Davis-Jones join us today, as well as Kristin Varner from Dauphin County Drug and Alcohol to give a special address and then also talk about the power of advocacy during Recovery Month. So we'll go ahead and get started as everyone starts piling in. Just go over some basic housekeeping. Please feel free to drop your name, organization, where you're calling in from in the chat to let us know who's in the room with us today. But in terms of housekeeping, just want to let you all know that the webinar will be recorded and a copy of the presentation will be available on the Life Unites Us website. All attendees will be muted during the course of the webinar, but if you have any questions for our presenters, please feel free to use the Q&A option at the bottom of the screen. And we'll be monitoring that closely during the course of the webinar. For best audio quality, you can listen to the webinar via your phone line using the dial-in number. And to switch from computer audio to phone audio, you can select audio settings on the lower left corner of your screen. If you get disconnected from Zoom, please re-enter using the original link and the host will let you back in. So I'll start by going over our agenda. We went over some basic housekeeping. I'll dive into give a brief overview of our campaign, and then we'll do our speaker introductions and our presenters will go over their slides with you all. We'll finish and wrap everything up with a question and answer at the end. And then if you all can submit a survey for the webinar, we always welcome feedback from the programming that we put on for you all. So going over a brief information about the Life Unites Us campaign for those of you that might be joining us for the first time. Life Unites Us is an evidence-based behavior change public health intervention designed to reduce addiction-related stigma of substance use disorders in the state of Pennsylvania. This is a campaign that is a collaborative effort between Shatterproof, Penn State, and the Public Goods Project in close partnership and funded through DDAP. So in terms of goals and objectives, our main goals include increasing the knowledge about substance use disorder and that recovery is not only possible but probable. We're trying to improve attitudes towards those living with or in recovery from SUD, and we're strengthening the capacity of stakeholders, both organizations and individuals that are already responding to the crisis on the ground. A couple other pillars of work. A huge part of the work that we do involves community engagement. So we're trying to connect with as many community organizations as possible across the state of Pennsylvania to build trusting partnerships and enable them to use our resources in a way that is able to reach their networks. In terms of content sharing, we're collecting stories from individuals all across the state of Pennsylvania. Our work is really rooted in the power of storytelling, and we use those stories to share across all of our social media channels. So if you're interested in contributing to the campaign, a main way to do so is by visiting our pages and sharing our content with your networks and promoting our message. And in terms of education, we offer technical assistance to our audiences via our webinars, which we host on a bi-monthly basis. And then we also have our data dashboards, data briefs, a number of other resources that you can access on our website. So this is just a snapshot of some of the content that you might find on our social pages. And then I encourage you to visit our website and look at some of the stories that we have posted there. They're really incredibly powerful and moving. So a last pitch to you all to follow us online. We are on Instagram, Twitter, and Facebook. If you're interested in sharing your story with us, we'd be more than happy to work with you. You can do so by looking at our link on our website and starting that process. And if you're interested in working together with us more closely, I encourage you to fill out a partnership form, and Jayla will drop the link to that in the chat now so you all can reference it. So without further ado, we'll go ahead by introducing our first speaker. Latika Davis-Jones is the Secretary of the Pennsylvania Department of Drug and Alcohol Programs, DDAP. She was nominated to the position in January of 2023 by Governor Josh Shapiro and unanimously confirmed by the General Assembly in June of 2023. Prior to serving as DDAP Secretary, she was the Senior Director of Behavioral Health at Highmark Whole Care, formerly Gateway Health Plan. Over the past 25 years, Secretary Davis-Jones His work has been focused on the physical and behavioral health needs of vulnerable populations. She provided leadership and administrative oversight of Highmark Whole Care's behavioral health program and oversaw the program development, including the development of operations within New Markets business initiatives and the implementation and evaluation of utilization management, case management, and disease condition management programs impacting the health of members. So with that, Secretary Davis-Jones, over to you.
Good afternoon, everyone. It's definitely a pleasure to be here today. As mentioned, I am Dr. Latika Davis-Jones, Secretary for Pennsylvania's Department of Drug and Alcohol Programs. And before I get started, I just wanted to say Happy Recovery Month, right? This is a big deal. It's a beautiful time, first and foremost, to be celebrating recovery. And I'm excited to share that throughout the next 3 weeks, I'll be traveling across the Commonwealth to do just that. If you could move to the next slide, that would be great. Thank you. So I'm going to kick off today's webinar by sharing a little bit of our SUD and overdose data. I'll briefly touch on some of the trends that we're seeing in relationship to xylazine and stimulant use, and I'll conclude with sharing some of our recent state efforts to address these issues, which include reducing stigma. So next slide, please. So you already heard a little bit about me. I don't think I need to go into detail on this particular slide, but as mentioned, for over 25 years, I dedicated my life's work to serving individuals with substance use problems. And I really do consider it a privilege to work for all Pennsylvanians today. You can see that I've held various positions throughout my professional career, which definitely lends itself nicely to taking on this role of Secretary of DDAP. But again, you can read the slide, and so we can just, go ahead and move on to the next. What I do really want you to know, though, is that the department is truly working to advance the governor's agenda by ensuring that we are expanding everything from education to recovery supports across the Commonwealth. And I am proud to say that it is truly refreshing that we have a governor that gets it. He firmly believes that a substance use disorder, an addiction, is a chronic relapsing disease. And so that's a big deal. And I'm glad that we truly do have a governor that gets it. So with that being said, if you could go to the next slide. Now we're going to talk a little bit about substance use disorder in Pennsylvania. Next slide, please. Pennsylvania, as many of you may know, we are one of the top 10 states in the country with the highest opioid use and overdose rates. We recognize that this is an issue that does not discriminate and that almost half of the general public knows someone with an opioid use disorder. And like in many states, we are seeing an increase in people using and dying from drugs. We are seeing on average about 15 overdose deaths per day. And based on some of the most recent prevalence data that we reviewed, 7% of Pennsylvanians have a substance use disorder, and almost 1%, 0.8% to be exact, have an opioid use disorder. And I should note that these numbers are truly comparable with what we're seeing within regional and national averages. And even with increased access to telehealth, overdose deaths in Pennsylvania increased during the pandemic, and they have not quite leveled off due to a host of factors. So if you could go to the next slide, that would be great. The graphic on the left comes from the Pennsylvania Department of Health, and it truly illustrates overdose deaths in Pennsylvania over the last 10 years, where overdose deaths were at their lowest from 2012 to 2015. We began to see a dramatic uptick in 2016 and 2017. And due to some of the interventions that were put into place, we were encouraged by the decrease in deaths in 2018 and 19. However, seeing a spike again in overdose deaths from 2020 to 2022. At this point in time, the 2022 deaths represent a 4% decrease compared to 2021. However, it should be noted that the numbers for 2021 and 2022 are still considered preliminary. as final reports continue to come in. This data is definitely representing data through, I think that's the end of August 2023. And while we truly recognize that there are many factors driving the increase in overdose rates in Pennsylvania, the main factor is fentanyl. Last year, 78% of all overdose deaths in Pennsylvania included fentanyl. Over half of all overdose deaths in Pennsylvania were specifically caused by fentanyl mixed with a non-opioid drugs such as benzodiazepines, methamphetamines, or cocaine. And in 2021, a staggering 43% of all overdose deaths in Pennsylvania were caused by fentanyl mixed with a stimulant. So this really underscores the importance of tactics like fentanyl test strips and carrying naloxone because today people truly do not know what will be in the drug supply. And the graphic on the right also comes from the Department of Health and illustrates the growing disparity in overdose death rates when comparing Black and white Pennsylvanians. It's a trend that has been observed for the past few years, but last year specifically, there was a more than 2 times higher death rate among Black Pennsylvanians, which is definitely alarming. And this trend is consistent with national data, and it truly underscores the urgent need for targeted and effective interventions for communities of color. Next slide. So in addition to the prevalence of fentanyl in the drug supply, xylazine has also been an emerging trend in Pennsylvania for the past few years. Again, according to data from the Pennsylvania Department of Health, in 2018, only 3 counties reported overdose deaths where xylazine was a contributing factor, spiking to 39 counties in 2021, where xylazine contributed to 575 deaths here in Pennsylvania. We are now seeing xylazine in almost every community in Pennsylvania, and in many cases, we know that xylazine is causing severe wounds and sepsis, and it's also leading to amputations among those that use drugs. I also wanted to note that on this slide, the data is reported through August 2023 by counties participating in enhanced drug overdose surveillance efforts. But a county indicated in gray does not necessarily mean that xylazine has not been detected in those regions, because counts between 1 to 5 have been suppressed due to few cases. So again, while you may only see the red, gray is there, and those counties are still also experiencing deaths by xylazine. So next slide. The data on this slide only reflects clients whose treatment was covered by single county authorities who are funded by our department. Single county authorities cover the care for those that are underinsured or uninsured. So Medicaid clients are not included in the graphics that you see here. However, these 2 maps really illustrate the changes we've seen in treatment admissions over the last 5 years, where a stimulant was listed as a primary drug of choice. In some of our northern counties, primary stimulant admissions were over 45%. So this data truly confirms what we're seeing in the overdose data and shows that stimulant use has increased significantly here in Pennsylvania. Next slide. So with that being said, if you could go forward, at a very high level, I want to briefly touch on the vision of our department under the Shapiro administration. We are building on our guiding principles tied to our RISE goals, that's RISE, which are really centered around the R, which is reducing stigma, I, intensifying primary prevention, and the S is really about strengthening our treatment system, and E, empowering sustained recovery. We will be developing a new state plan that builds on what worked and eliminating what didn't, while introducing new interventions and approaches that bring additional value to consumers and other key stakeholders. Some of our efforts will include enhancing current data infrastructures to allow for data sharing and more timely access to data. And we're going to also be looking at collecting data for program evaluation and quality improvement efforts. We will also be prioritizing and implementing interventions related to health equity and addressing racial disparities, while also exploring the possibility of a treatment slot management system for a streamlined treatment and recovery experience. And we'll be looking to improve consumer, provider, and other key stakeholder experiences via streamlined communication processes. So looking at all of our communication channels, whether it be our website or our social media channels, how we are sharing information via email, all of those things are under review. And lastly, we will be engaging in regulatory reform efforts to encourage evidence-based program design. So next slide. Through our opioid settlement funds, we are definitely making a difference. We've had an opportunity to issue grants focused on SUD crisis stabilization. Also, there's been a focus on Black, Indigenous people of color communities. And we have also focused on workforce supports, which includes a loan payment repayment program to retain people in the addictions field. To date, we have awarded over $33 million in funding. In addition, we are also building out our recovery infrastructure and continue to license recovery houses to ensure that Pennsylvanians have access to safe and supported housing. In addition, we've had an opportunity to attend some national events. We have joined the White House Office of National Drug Control Policy officials for a convening in Philadelphia to discuss the emerging lethal threat of xylazine and ways to combat that particular trend. DDAP's Life Unites Us campaign, we're joined with them right now, was presented at the Global RX Illicit Drug Summit in Atlanta, Georgia. We shared the success of that campaign, which reached almost 28% of Pennsylvanians with a stigma reduction message. And I recently visited the White House for a briefing focused on lowering prescription drug costs. Next slide. A few other items we've worked on this year include expanding our Just 5 SUD prevention program with 3 new lessons, one of which was focused on fentanyl. We also released our second annual online gaming report, which can be found on our website at www.ddap.pa.gov. In addition to that, we've held several SUD workforce listening sessions and released a workforce report, which can also be found on our website. What I'm most proud of is that, that survey that we administered to develop the report had well over 500 individuals across the Commonwealth participating. And so I'm really proud of that work. And also, we have a very aggressive naloxone saturation plan. Individuals in Pennsylvania can get access to free naloxone through various means. To date, we have distributed over 500,000 free kits, 348,000 in 2022 alone, which is really driven by our online portal and our pharmacy copay programs. And we've also worked on legislation to legalize fentanyl test strips, thus the expansion of our Pennsylvania overdose prevention program to now include drug testing equipment, specifically test strips for xylazine and fentanyl. We are in the midst of a stakeholder engagement tour, We are going region to region, meeting stakeholders and truly engaging with stakeholders, but most of all, really listening to stakeholders on all things related to regulatory reform. This is a comprehensive approach that we're taking to engaging relevant stakeholders. We expect to, come away with quite a few things, but some of the key objectives of this tour include gathering input from a diverse range of stakeholders to ensure that the regulatory reform process considers a variety of perspectives and concerns. We're also trying to foster transparency and open communication between DDAP and its stakeholders. So it's important that we're building trust and understanding. We will be working toward ensuring that the regulatory reform process aligns with the needs of different stakeholders while also addressing broader social issues. And last but not least, it's important that we are creating an inclusive environment where stakeholders can contribute their insights and expertise to develop effective and practical regulatory solutions. So I am, really excited about that work as well. Next slide. And this is just a slide that I put in to really outline our overview of our engagement tour. So if you can go to the next slide, that would be great. And, since we are in the heart of Recovery Month, I'd like to close out my presentation with providing an update on our priorities and initiatives in the recovery space, noting that we all know that recovery is for everyone, every person, every family, and every community. I want you to know that all of us at DDAP live by that every day and the work that we do. It can be seen in the establishment of our recovery section in our Bureau of Program Oversight. We just started that particular unit in spring of 2023. And right now we have 2 positions slated within that unit, which is a program analyst and a program manager. It can also be seen in the funding of the start of 9 regional recovery hubs spanning the entire state of Pennsylvania. Those awardees are granted up to $500,000 to do that work. And we will be, as a part of the recovery hubs, what I'm excited to share is that those hubs will be conducting recovery needs assessments, and those assessments will inform the priorities of each of the hubs, and they will be working to build and expand recovery resources and services in their geographical locations. The hubs will also be providing technical assistance to organizations that provide recovery support services. And, the goal is for them to work with our recovery equity coalitions. Our first recovery coalition started already in the Northeast, and the remaining coalitions will be established in 2024. So this is the work that we're doing. We're excited about the work, and we're going to continue to advance the governor's agenda. But with that being said, again, happy Recovery Month, and please, let's stay in touch. If you can go to the next slide, my contact information is there. But again, happy Recovery Month. And that's it for me.
Thank you so much, Secretary Davis-Jones. With that, I will introduce our next speaker. So Kristin Varner received her BA from Shippensburg University in August of 2000. She currently serves as the Director of Dauphin County Drug and Alcohol Services. Prior to working for Dauphin County, she worked at a nonprofit recovery community organization known as the RAISE Project. Kristin has served on several community-based committees, such as the Substance Abuse and Prevention Coalition of Cumberland County, Sarah's House of Hope Board, the Cumberland County Opiate Overdose Coalition, Board Secretary of Consumer Satisfaction Services and co-chair of the Dauphin County Hope Collaborative. She was also appointed to the Citizens Advisory Committee for Cumberland County Children and Youth from 2013 to 2019. Kristin was appointed by the governor to the Pennsylvania Advisory Council on Drug and Alcohol Abuse in 2018, and she's an active member of the recovery community and has been in recovery herself since September 2nd of 2005. She currently resides in Harrisburg with her husband and 4 children. So Kristin, over to you.
Hey, Ashley. Oh, there, did I come on now? Okay, there we are. Hi, everyone. Thanks for that introduction, Ashley, and thank you to Dr. Davis-Jones for that great presentation on DDAP's priorities. Thank you for talking about Recovery Month. That's why I'm here, to talk a little bit about Recovery Month and to really make, if you choose to come to the Capitol next week on September 19th, to make it an easy trip for you and something that is going to be fun. Because, you know, when I first started going to the Capitol many years ago with the Recovery Advocacy Day, I was nervous in the beginning. I wasn't used to talking to, you know, my legislators. I was worried that I was going to say the wrong thing. I didn't want to go in by myself. So I'm really just here to talk to you today, just for a few minutes, about how to make that transition pretty easy, and some tips and tricks on how to make that day go by, you know, fast for you. After I'm done, then you'll have the opportunity to come on in and ask us questions. And I'm sure you have a lot more questions for Dr. Davis-Jones, and that's fine. But I plan on ending to giving you guys plenty of time to ask questions. Okay, next slide. So we're going to talk a little bit about advocacy, and then the history of advocacy in Pennsylvania, followed by what to do during your legislative visits, your presentation that day, and of course, social media, because if it's not on social media, it didn't happen, right? So we're going to talk about that too. Next slide. So what does advocacy mean? Advocacy really is defined as an action that speaks in favor of, and it argues for a cause, supports or defends, or pleads on behalf of others. It does give a voice to marginalized communities, so we aren't forgotten. And successful advocacy also teaches people about their rights and how to exercise them. Additionally, advocacy can help people confront the challenges they may struggle to overcome on their own. So there's 2 really good resources that I implore you to check out. The first one is Faces and Voices of Recovery. And that's where I learned how to speak as a recovering person, how to tell my story, the do's and don'ts. They have terrific information on there. I highly suggest that you check it out. They go by the acronym FAVOR, and there's tons of information on there. The second thing that I really ask that you take a look at is the Recovery Bill of Rights. And in order to get the Recovery Bill of Rights, all you have to do is Google search it, but that you can order a poster of your Recovery Bill of Rights. I didn't know if you guys even knew, those of you that are in recovery, that there is a Bill of Rights for the recovering community. But when you read it, you know, take extra attention to number 8. And number 8 says, we have the right to be represented by informed policymakers who will remove barriers to educational, housing, and employment opportunities once we are no longer misusing alcohol or other drugs and are on the road to recovery. So it's really important that you look at your rights, look what people, what your predecessors have fought so hard for, because advocacy, especially in Pennsylvania, has a really rich history. And there's been a lot of individuals that have come before me that have worked very hard at the local, the state, and the federal level in order to get us our rights. And when I continue to say I am a woman in long-term recovery. And what that means for me is that I have not used a drink or a drug since September 2nd, 2005. I say it like that is that's how I was taught to announce and introduce myself. There's different modifications that you can use, but basically explaining. So what I did there was I explained what recovery means to me, and that since September 2nd, 2005, I have not used a drink or a drug. You could say other things. I think a lot of individuals have asked me over the years, what if I only have 30 days in recovery? Well, once you make that decision to be implanted into the recovery process, you're considered to be on the road to long-term recovery. So that's how you can introduce yourself always if you're in recovery. Next slide. Okay, so I did allude a little bit to the history of advocacy in Pennsylvania. We've been doing Recovery Advocacy Day for a number of years, and it's an annual event. We even made it through the pandemic. We ended up doing a virtual event, the year that we were completely locked down, and it turned out to be an actually really nice event, but it allows participants to engage with their legislators, share their story, convey a message of hope that people can and do recover. That is the message. We had started years ago with certain items that we wanted to talk about, and we realized that it was more impactful if we go into the Capitol and we do meet with our legislators, but we just share our story very briefly, and we thank them for their work, and we encourage them to continue working for our rights, and we also encourage them to use us if they need us, use us as a resource. The mission of this day is inspiring others to advocate for change, to reduce stigma associated with substance use conditions. And our vision is, with the power of unity and the courage to change, we envision a world where recovery is celebrated and available to all. Next slide. So the first Recovery Day was in 2015. So I'm going to talk a little bit later about what that day is going to look like. There's an organization called Pro-A. I think I saw someone from Pro-A on the call today, but they've done a lot to document the early recovery advocacy and recovery movement in Pennsylvania. I do have some links to some of that literature, which I can see if you'd be interested in getting it. I can have Ashley send it out to you. I would suggest that you take a read just to see what has come before us. But years ago, there were grassroots organizations that were set up all over Pennsylvania to give a voice to the recovering community. So organizations such as Pro-A, message carriers, I believe that there was 5 of them throughout Pennsylvania, and really Pennsylvania started to become advocates for individuals. And one of the reasons why I was always told, for instance, I came from an organization called the RAISE Project, if you heard that in my bio, and I was always told that one of the reasons why the RAISE Project, first of all, stands for Recovery Advocacy, Service, and Empowerment, and the advocacy part was really to be a voice because there was a lot of battles going on between the insurance companies and the treatment centers, and they needed a neutral third party that could go in and could advocate and could call up and have individuals stay extended, or at least get them that 30 days. I mean, this is before ASAM, but get them that 30 days that they needed at that time. And because of that, a lot of other bills were passed just because of everything that had been started here in Pennsylvania. Another really good resource for you, if you haven't watched The Anonymous People by Greg Williams, please do so. I know it's on Amazon, Apple TV, YouTube. I believe that there's a couple organizations probably somewhere in your community that has a copy of it for free that you could probably borrow the DVD, because it came out on DVD first. So I would definitely suggest that you reach out to your local recovery community organization and see if they have a copy, because I did do a quick search and I saw that on Amazon, Apple TV, and YouTube, it was a couple dollars to watch, but it's worth it. It really does. And if you're going to watch it before you come down to the Capitol next week, because it really does give you the energy to come in and really try to make a difference that day. Next slide. Okay, so legislative visits. We'll just talk about why I'm here. You got a plan. And I know that you may not think that you have enough time to plan for the visit next week, which may be true. But this is also to think about next year what you need to do. So if you have a group of people that you're working with, you need to find out, how big your group is and what district everyone lives in. And all of that is on the PA legislator website. You can go in, you have to type in some information about where you live, and it will bring up your representatives. And from there, you're going to need to start calling and talking to their secretaries more than likely, and telling them why you're coming to the Capitol that day and that you would like to schedule a visit. Now, the likelihood that you will get a visit if you call tomorrow or today, I mean, I don't know, maybe a 50-50 chance that you might get it. They are in session that day. But I would suggest that you start this at least 6 weeks ahead of time, preferably 8 weeks ahead of time. The good news is that on next week, if you come in, you can also just drop in. You don't need an appointment to walk into their office and talk to their administrative assistant, leave information, and sometimes you'll get lucky and be able to catch one of your representatives. And there's the schedule that you can find your legislator on the link that is embedded here in the PowerPoint. And during your visit, like I said, you're going to want to introduce yourself. It's helpful to have a speaker for the group. If you're by yourself, obviously you're the only speaker. But even if you're shy, make sure that there's someone that's very comfortable talking. But remember, they are very busy individuals. So you're going to talk and say you're a person in long-term recovery from a substance use disorder, and what that means to me is. And then you talk about what recovery means to you. You're going to share your story, but remember that we're not looking to war story. We're not looking to talk about like what we did. We're looking to turn the attention to what our recovery is like, or what it took to get to our recovery process. That's very important. Because sometimes people like to ask us questions about our addiction, and that's okay. But you can also say, what I'm here to talk about today is my recovery. And then you go from there. You offer to be a resource, and you always be truthful. Don't make anything up. Don't embellish anything. Just give the facts about what you're comfortable with about your story. And you leave behind local events and resources. So if I was going, I am going next week, I would probably leave behind some of our Recovery Month events and invite them to come out and see us and see what the recovery community looks like. I would invite them to come to some of the recovery community centers here in Dauphin County and say, come take a look, a tour, and meet some people. And always leave your contact information. And finally, when you're done, you're going to want to send an email or a note card thanking them for a visit and letting them know that you'll be back again next year. Okay, next slide. What to wear. Okay, this one, you got to be careful. I've seen all sorts of types of dress show up on this day. It's important that we represent our recovering community. So yes, you can wear t-shirts, but like if you're going to do the t-shirt route, which actually I might be doing that on Tuesday, is that we all have purple shirts that says we do recover in Dauphin County. That's what our shirts say. I wouldn't suggest you just wear any t-shirt out of your closet. I would say if you wear a t-shirt that you get together with your group and you create them for that day. Otherwise, wear business casual, no jeans and holes, no spaghetti straps, no flip-flops, like you're going somewhere professional for the day, because they're going to be professional and we would like to try to match their energy a little bit. If you don't have that, that's okay too. You can always talk to your local recovery community organization, see if they have a clothing closet, and if they don't, then we'd still rather you show up than not. But I did make the mistake my very, very, very first year. My shoes actually broke on the way, so I had to wear sandals, flip-flops, and I felt very out of place. So I'm just going to let you guys learn off of my mistakes. I wouldn't do that. Language matters. You know, you've got to try to use anti-stigma language. I know that the secretary had been talking about that. There was another link here in the presentation to talk about what type of language is appropriate. We want to get away from using terms such as addict. I know that some of you may be in mutual support groups that use that, and that is absolutely 100% okay and needed within those groups. But when we're talking about ourselves to a legislator or a representative, we want to make sure that we're using language such as a person living with a substance use disorder or so forth. Just take a look at it. The language continues to get better and they continue to tweak it. So I even have to look at it before I go in to make sure that I'm not saying anything incorrectly. So take a look at that. There was a study done, and I think this is on SAMHSA, but it was basically saying that there was a group of doctors. They split them up into two, and they told each group the same exact story. But in the one story, they referred to the individuals as addicts and as prisoners, and in the other group, they referred to them as people living with a substance use disorder. They used non-stigmatizing language. At the end of the day, they were both asked to give their recommendations. The group that received the non-stigmatizing language wanted these individuals to receive treatment. The ones that received the stigmatizing language wanted these individuals to be incarcerated. So it really does matter when we're talking to other people who may not know much about the road to recovery. Be early for your visits. Legislators are busy. Please show up. Please do not make appointments and not show up. That does not look good in our community. We want them to know that we stand by our word and that we do show up. So if you make it and you can't show up, at least give them a call. Be prepared for changes to their schedule, and you may have to meet with a staffer, and that's okay because they're there to they do the work. They report that work back to their legislator. It's okay. And you got to relax. Learn that you're just there to make a human connection. You're not going to mess this up. You're going to go in and you're going to take a deep breath. You're going to go in and say what you're supposed to say. And next slide, please. Okay, and like I said, social media, it doesn't happen if it's not on social media, right? So use hashtags for the day, share pictures. An example could be this year, RAD, Recovery Advocacy Day 2023. If you haven't registered, so the event is at the state capitol, Pennsylvania State Capitol. It is all day. It runs from about 10 till 2. Tables start setting up around 9, so I'm sure they'll be set up by like 9:15. If you want to get there early, do your visits. There's a media event that begins at 12, and that goes to about 1:30. And we have a variety of speakers that day. We do have the secretary from DDAP again coming. We're very excited for that. We have some recovery community members sharing their story briefly. We have commissioners. We have a commissioner from Wyoming County showing up, Representative Jim Gregory, Senator John Kane, and also a family recovery community member. So it should be, you know, if nothing else, if you really say, hey, I'm not ready this year to go visit people, but I want to show up. I mean, really, this is our chance to show Pennsylvanians that there's recovery in Pennsylvania, and we are here, and we're loud, not loud as in obnoxious, but we're loud. Like we want people to know about us. And with everything going on right now, like if you're able to come out of the shadows and share your story, because not a lot of people, you know, many people know somebody that's addicted, but do they know somebody that's in recovery? And if you're able to make that change, I would say, please do. I see that Brittany did drop the Facebook event into the chat. So it's www.facebook.com/recoveryadvocacy. And Michael said you can see pictures and videos from previous years. So I think that's it. I don't think I have another slide, do I? Let's see here. There it is. Register on Eventbrite. Again, it's September 19th. We would love to have you. It's not too late to register, so please register. We have people sometimes getting on buses and coming in, and it's just a fun day. So I'll be there. And so that's at least one familiar face you will see, and we really hope to see you there. That's all I have.
Thank you both so much for the informative presentations. I just briefly looking at the chat and getting some questions in, so please feel free to drop them if you have any questions. Just starting off with some of the ones that we've gotten in the chat so far. There seems to be, some interest in learning a little bit more about the DDAP grant program, and I know that we answered some of that in the chat, but just if Secretary Davis-Jones, if you could talk a little bit about what kind of organizations would be eligible to apply for this sort of funding.
Yeah, for the recovery housing specifically, the funding is for organizations that are licensed by DDAP. So if the recovery house has gone through the licensing process, they would be eligible to apply for the recovery housing funding. Noting that the grants that we have available, they're one-time grants up to $50,000 to support the infrastructure and the development of recovery houses. But if they're interested in looking for funding to support individuals and interested in staying in a recovery house, that's a relationship that they would have to establish with the single county authorities and their geographical locations to get a contract so that funding source could be used for the payment, the monthly payments for individuals staying in those homes.
Thank you so much. And then, just switching it a little bit over to advocacy, and thank you, Kristin, for providing all those tips and tricks. Definitely beneficial as you're getting ready to do visits or just be part of the event. But for individuals that might be going, are there any specific legislative or policy initiatives that advocates should be aware of?
So yes, you should always be aware of them. On this day, we do ask that, again, we just go in and we share our story and thank them and be a resource for them. However, if you get on Faces of Voices of Recovery, you can look at what they've done and what the plans are for the future. There's also the Partnership to End Addiction. That's another really good one. That's more for families. We'll talk about like the legislative priorities that they have. So, and then of course follow suit with Department of Drug and Alcohol programs. But I would say absolutely for that day, our message is clear. It's just that recovery works.
Thank you so much. And again, a lot of the links that we've talked about, we would be sending out in a follow-up email so you all can have access to this content. And so just a question for, the both of you, a little bit more general, but are there any specific tools or resources that can assist individuals and organizations in their advocacy efforts?
Yeah, so for me, I'll start by saying SAMHSA is going to always be an excellent resource for individuals to look at. They have lots of information on their websites, everything from recovery treatment to prevention services. So that's available. The Centers for Disease Control is another opportunity for people to look at as well. We do have some resources on our website, but I think Kristin definitely hit most of them, key resources and tools that they could use. So Kristin, I'll turn it back over to you to just highlight those again. But yeah, those are the two. I gave like two federal resources.
No, those are exactly the ones that I would say as well. And I wouldn't steer too far off of SAMHSA, Faces of Voices of Recovery, Partnership to End Addiction, DDAP. Like you really want to stick, if you're going to support us and support this day, I would really stick closer to those. And they're the ones that have been, true and vetted, and they have a lot of clout behind them.
Well, thank you all both so much. I hope folks are feeling energized about Recovery Month and ready to, advocate for furthering our efforts in the state and excited about what's to come with DDAP. So that concludes our programming for today. Jayla will go ahead and drop the survey link in the chat if you would be so kind as to fill that out for us, just to get us a sense of how we're doing. And Kristin, Dr. Davis-Jones, thank you again so much for taking the time to join. And I hope everyone has a lovely rest of your day.
You too. Thank you. Bye-bye.